I saw a graph on Twitter recently that literally just blew my mind. I thought, goodness gracious, how can this be ignored for so long? And now I'm not a statistician, and I don't have the time to sit down and go through all of the data. And so I appreciate when people do that. But what I'm going to show you, I can't corroborate myself. This is work that this is someone else has done. He's explained what he's done. And so if somebody wants to corroborate what he's saying, they have to sit down and do the work themselves. But this was from somebody called the ethical skeptic. And he's a statist. Well, he works with data and he produces lots of interesting data points for us to look at. And one of the things that he highlighted here, and this is it here, one of the things that he highlighted here was this question about sudden cardiac death being elevated. And I'll show you the image here. What he did is that he took sudden cardiac deaths between the age of 0 and 54. And then he had the mortality trend down here in 2018, 2019, looking at the average before the pandemic. The conditions that he looked at, and so he was looking at these ICD codes. This is from the CDC. So you literally have to pull out each code on its own. So cardiac arrest, conduction disorders, paroxysmal tachycardia, atrial fibrillation. So all of these codes, he then pulls them out and puts them together. He excluded, I think, the drug overdose people and just concentrated on respiratory arrest, cardiac arrest, heart failures, and so on in the age group 0 to 54. And then, as I said, he was monitoring it between 2018 and 2024 in, I think, a 15-week period cycle. And what you can see here is that 2019 coming to 2020, the beginning of the pandemic. So you can see a spike here, which fits because the virus can cause inflammation to the heart, especially if people get moderate to severe COVID 19. And it comes down again a bit, goes back up. This would be in 2020, that would have been the second wave in about October to December, and then there is this dramatic rise going into 2021. What he's done is these dark red lines represent the vaccine uptake period. So this is when the highest amount was taken up, and then these would be the boosters, and so it gradually went over time. I don't know why he put the vaccine update period in, because I mean, it's not as if it could be connected. I mean, it's just you can't be serious. There is no way that this could be right. Now, in truth, we may not have any better explanation for what is going on, but it doesn't mean that it needs to be looked at. I think that's the important point. Everybody's a bit baffled. They don't quite know what's going on. And yeah, we don't know either. Maybe people were smoking more, or maybe they're drinking more alcohol. It could have been that they weren't exercising enough during the pandemic period. And then suddenly in 2021, they just start having cardiac arrest. This is how it works. I think that it's not what I see in clinical medicine in general, but this is what we're being told. It makes perfect sense, doesn't it? But just look at the image again and just think about it for a second. This dramatic rise here in 2021, it stays up. Now, it couldn't have been the Delta wave because the Delta wave was down here. So there was an increase after the Delta wave, and it did peak there. In 2022, that was Omicron. And then we had, I guess, Omicron circulating late in 2022. It's still circulating now. And essentially, it's staying up there. And he measured it in 2024. It was an excess of 568 deaths in the age group 0 to 54. And what he describes it as is a 19 sigma increase. Now, I'm not a statistician. All I know is that even a 3 sigma change is huge. It's like, a remarkable. 19 is like out of sight. This is aliens dropping in front of you kind of experience. So this is significant. Now, I have to maintain the narrative, and I have to say to you that we don't fully know what the cause of this is. We are not allowed to speculate because speculation may bring in conspiracies and link it to actions that happened around that time that clearly could not have been relevant. And to even think it, I think, is inappropriate. Even to think it, you probably should be censored for that. But it doesn't matter that I don't have a good explanation. It just matters that, according to the narrative, you're not allowed to make any associations with that. And let me just remind you again, just because this occurred in the similar time frame as this occurring doesn't mean causation. I mean, correlation does not mean causation. There could have been 101 reasons outside of this that caused this dramatic rise and caused it to hang about for 3 years. So don't go thinking anything and going telling your friends what's happening. It just doesn't work like that. You have no evidence that that is the problem. And you know why you don't have any evidence? Because these autopsies are not being published. That's why you have no evidence. Because, quite frankly, if you actually really wanted to know, if you really wanted to check, you do autopsies. That's what we're not doing. Or if they're doing them, they're not publishing them, which is even worse. So we don't have any idea what is going on. But I'm going to share with you quickly a piece of research. Just a reminder, I did a whole presentation on this because it was so important. But this piece of research was in 2023, and they were looking at assessment of myocardial FDG. This is glucose, labeled glucose uptake in PET scans in asymptomatic SARS-CoV-2 vaccinated and non-vaccinated patients. And these guys were clearly curious, and it's good. This is the kind of thing that science normally does. They're looking for patterns and they're looking for specific things. And what they had done is that they got a baseline cohort, so patients who underwent the um, the the scans in the period 1st of November 2020 to the 16th of February 2021, and then they compared it to people after February 2021 to March of 2022. And they were specifically looking at that because there was a question regarding myocarditis. And so they were looking for myocarditis because a lot of people don't realize that in reality, the heart doesn't actually use glucose as its primary source of energy. I'm just going to show you these slides here. This was from the presentation that I think is probably worthwhile sharing with you. This is how it generally works. This is heart muscle. And what I've put in here is lots of mitochondria. So the mitochondria are the powerhouses. They're the generators inside the cell. And they produce all the ATP and the energy going around so that the heart can contract. And this heart contracts easily 70 times per minute, 365, the 24 hours a day, 365 days a year. And depending on how you live, it just keeps on pumping. And so it needs a lot of mitochondria to produce energy all the time. And it needs to have enough so that even if you're put under stress and you needed to run, or get away from something, you have the reserve in the heart. And it does this because it has lots of mitochondria. Now, what's very interesting is that 30% of the volume. What's very interesting, I'll show you this here, is that when it comes to the mitochondrial use, the heart uses free fatty acids. So it uses fat, not really glucose. So up to 90% of the energy being produced by the heart is from fat, and only 10 to 40%, depending on what's happening. So if you're exercising and you can't produce enough energy from the fatty acids, then you have an overlap where you start to use glucose as well. But primarily, this is fat driven in terms of the heart. So that's very important. And that's important because that's why they did the research, because they thought that if there was evidence of myocarditis, they would see a change in glucose usage simply because the immune system tends to use glucose. And so, what they then did is they compared the vaccinated to the unvaccinated. And what you would expect to see in a normal scan is something like this. So, wherever it turns out to be black, dark, that's where it's taking up a lot of glucose. So, you can see the brain pulls a lot of glucose. And then you can see a lot of glucose is being used in the kidneys here. But if you look at the heart here, and the liver is here, it doesn't really take up a lot of glucose in a 43-year-old male. And in an 80-year-old male, these are the people who are unvaccinated before, it's still not really taking up any glucose. And that's because it's primarily using fat as its source of energy. But post vaccination, in this 38-year-old male, you see this very high uptake of glucose. And the 72-year-old male, not as high, but a much higher uptake of glucose than in the 80-year-old. Now, I mean, call me silly, but I think that that is very relevant. I just don't understand how people can ignore that kind of thing. What are you thinking? Why would you ignore that? Why would you not say, wow, that is important? Let's try and understand what the heck is going on. And when they did the study, you have to realize this is when they split it again into the unvaccinated and the vaccinated, and they used a simple scoring system where 3 was the highest uptake, 2 was intermediate, 1 is low, 0 is none. And this is the non-vaccinated cohort here. It was only 300 people and 700 in the vaccinated. But what you can straight away see is that the highest cohort was 3. Of the 700, even higher than 0, this existed. This is absolutely frightening. And if you compare them here, non-vaccinated and vaccinated, you can see clearly in terms of the maximum uptake much higher in the vaccinated cohort. And so part of my presentation was looking at the mechanisms. I thought that myocarditis was one of them. I thought that potentially damage to the mitochondria through the spike protein could be another one, other forms of inflammation, all kinds of things. And it's important to note that the time frame is up to 180 days before it seemed to resolve. So it did disappear eventually, but it took over 180 days. That's 6 months. So then you have to think about that kind of research. And I take you back. And again, I say, no, just think about it a moment. There is clearly an abnormal pattern occurring in the heart of the vaccinated cohort for up to 180 days. And then you have a situation like this that is occurring where there's a rapid rise and a stabilization at this level of sudden cardiac deaths in people below the age of 54. So this is not imaginary. So all these people you hear falling about the place, it's not in your mind. It is real. We have just not clarified why. Now, people can presume the cause, and this is what's happening at the moment, is that there are a lot of presumptions, and people presume when they don't have facts. And I'm sorry to tell those narrative people that the only facts that I would accept is autopsy. I want to hear about nothing else. I don't care what kind of research you have done. I want tissue from these hearts. I want to know exactly what is going on in this heart muscle. I want to know why they're having these conduction arrhythmias and so on. What is going on? Is this part of the reason why we're seeing so many cases of heart failure? Because that process has been accelerated. Without autopsy, you will still be blind. We will leave it for another 10 years and still be speculating about, well, it could be COVID. It's certainly not the other thing. It can't be, but maybe it's some kind of thing with COVID. We don't actually really care about why COVID would be doing this. It's okay as long as it's not the other thing. That's how we're approaching the science now. And I tell you this, I'm getting tired of trying to beat around the bush, but I don't own these platforms, so I have to play by their rules. But the reality is that anybody at this point who is not asking questions, I consider a part of the problem. The issue is that they are not being, there is no consequence for them doing that. It doesn't matter how many people die or how many people got sick. Oh, well, if turns out there's a problem down the line, oh, well, maybe the clinicians should have pushed this more because they were seeing this. They would have been seeing that their clinics are full of people with heart failure. I'm just warning the clinicians on this. I'm just telling you up front. I know what you're seeing, and I'm telling you that if you sit on this, it's going to blow up in your face. They are not doing it to protect you. I cannot grasp for the life of me why you are trying to protect them. Ask the questions, do the audits, look at what is happening in terms of your echocardiograms, observe why you are seeing a significant trajectory. If you haven't done the audits, I'm telling you, let me tell you what's going to happen. Just in case there are clinicians who are watching this, I'm going to tell you exactly what's going to happen. While you are there following the narrative and going along, well, I don't know, we'd have no evidence of da 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 da. When it does explode, and when the research is done, because at some point somebody has to say, we've got to look at this. When the research is done, they are going to say, oh my gosh, look, oh, this was occurring. The same people who were telling you what to say and telling you that you can't ask questions, you can't go against this, are going to then look at you and say, I can't believe that you were seeing this all the time and you didn't raise a concern. I'm speaking directly now in case there are clinicians listening. I am telling you that this is what is going to happen. When your clinics are full, when you've had all your echocardiograms done and you're seeing end stage heart failure in people that you have never seen this pattern before, and you are just kind of going along, you're going to find that the same people you were trying to protect, and for whatever reason, I thought you should be advocating for your patients, not the narrative. Those people are going to flip it back on you and say you were the problem. You were the incompetent ones because you didn't say anything. They're going to say, we didn't know this was an issue, and we can't believe that you saw this and didn't say anything. The public is then going to say, oh my God, I can't believe that you did this. Your reputation is going down the bin. I'm just telling you. I'm trying to save it here by talking about these things because there needs to be a realization among the public that the reality is that it is not easy to speak about these things. You risk your whole career talking about these things. Why would anybody want to do that? It's not their problem that you're going to have heart failure in the future. It's not their problem that you're having sudden deaths. Until this is acknowledged at the very highest level, right at the top of the government, which will then force the big research institutions to do the research. Until that happens and the guidelines start changing, and the guidelines now expect people to look for this, nothing is going to change. The sad part is the reputation that has been being built up for years by clinicians working hard, seeing patients, treating patients, is going to be absolutely permanently tarnished by this situation. It's horrific. And I can see it happening. I listen, I do the social listening, I look at what people are saying, and I'm thinking to myself, it is so unfair to so many hardworking clinicians who are stuck in this narrative, who are afraid of asking the question. They don't even want to think about it. But I'm telling you, if you don't do it, you're not advocating for your patients. If you are seeing things happening different from normal, you've got to ask the question. Do the audits, look at it, push it up the line. Let somebody be responsible. But I am just saying it really, really is frightening. We cannot. This is in the US, but I guarantee you this is happening all across the world. Same kind of picture in New Zealand. This is unacceptable. How can this be? How can this be? We don't know. This is not even a month down the line. This is 2021, 2022, 2023, 2024. I don't know what to say. I genuinely don't know what to say. And the public, you've got to push this. You've got to. If you sit on it as a public, and then I am, by the time you realize what the implications are, and just to pick the issue of heart failure, we can't fix it when we realize. We can just say, oh gosh, I'm sorry. Yeah, you can't walk more than 15 yards, but maybe if we had known earlier, we could have intervened. It is going to be your problem. The clinicians is going to be your reputation. The people who are probably blocking the kind of research that needs to be done are going to walk away from this scot-free. What can you say? Yep, that's my rant for the day. I really do feel upset about this, and it's because it's not just about one or the other. And this is why I'm talking about the COVID storm, is the combination. This combination of ongoing circulation of the virus, which can cause inflammation in the heart, especially Omicron, and the fact that the immune system has been primed and so many people can no longer stop the infections, this is an absolute disaster. And the question is just when will it be so blatantly obvious that it has to be addressed? And if that's the time that we have to reach, maybe 2 years, 3 years of this continuing to rise, when it's your relative, then maybe you'll start to feel it. But this is pretty serious, and it is incumbent on the public to push the fraternities, and it's not individual doctors, it's whole systems, governments. They refuse to investigate excess deaths in different governments across the world. Andrew Bridgen lost his seat because he was asking about excess deaths. Which other politician is going to dare to do it? Who is controlling this? Who is driving this? They are hoping it goes away, but I can warn them. Let me tell you, whoever you may be, just listen carefully. It could have gone away if the virus stopped circulating, and it would have disappeared into nothing. But the virus is still circulating. This is only going to get worse. The faster you address it, the better your chances. of not being caught up in the outcomes. That's my rant for the day. And as usual, make sure you look in the description for any links, and I'll share some more information with you in the near future.